Welcome to this video. My name is Pedro Rodrigues Ribeiro. I'm a psychologist from Portugal, and today I would like to introduce to you multimodal therapy as an integrative model of psychotherapy. This is quite debatable because uh, you might consider multimodal therapy to be a model of psychotherapy more directional to behavioral therapy and cognitive therapy because of Arnold Lazarus, the creator of multimodal therapy, inclinations towards psychotherapy. However, Dr. Lazarus was a really integrative therapist. His ideas into integration devised multimodal therapy as an eclectical model, technical eclecticism. That's the word. Technical eclecticism is one form of psychotherapy integration. What it means is that in its conceptualization and intervention, multimodal therapy relies into different techniques that originated into different psychotherapy models as towards the situation, the necessity, the characteristics of the person. But I digress. Arnold Lazarus was initially a behavior and a cognitive therapist. He was a key figure in psychotherapy history and one of the originators and the vanguards into behavioral therapy, as for example Joseph Wolpe. However, as Joseph Wolpe and other therapists, Dr. Lazarus had really an integrative perspective on psychotherapy. Such perspective gave birth to his model, multimodal therapy. Multimodal therapy is a combination of behavioral therapy with a systemic view. What it means is that the way that the person was evaluated and also the intervention part was in the systemic thinking. We are most used to in individual therapy to evaluate it and intervene only with the patient and reminded of his history and his struggles and his resources. What multimodal therapy said is that the patient is inside systems of relationships. Someone is a son or a daughter, a friend, or a husband or a spouse. People are always integrated into different systems. So, multimodal therapy analyzes the person within a certain context. The form of evaluating an intervention is really eclectic because it brings concepts from cognitive therapy, behavioral therapy, emotional theory, affect theory, but also systemic views as towards interpersonal relationships. The main tool of multimodal therapy is what is called the basic ID. The basic ID is well, a lot of words and components. It's a abbreviation of a lot of things. So B is for behavior. The multimodal therapists evaluate the patient's behaviors. A is for affect, what it is feelings, what it is sensations, what it is thoughts. I digress. It's not sensations and thoughts that's more advanced. So A is only for affects. What are his feelings or her feelings towards a specific situation, a specific relationship, etc. S is for sensations. What sensations is the patient is the patient realizing in his body? What his sensations are happening in his body in specific situations? E is for imagery. What is his images? What type of images? What type of visualizations does the patient has? Um, Someone can understand that really near to cognitive distortions, the way that people perceive a certain situation. C is for cognitions. What are the thoughts of the patient? So when integrating cognitions into what it is a behavioral therapy aspect, really we are seeing something close to CBT in the relationship between thoughts and also behaviors. Initially, behavioral therapists didn't consider cognitions to be that important, only behaviors. Um, so that's the basic part. The ID, it's other thing. The E is for interpersonal relationships, and that represents the systemic part, the systemic view, the systemic thinking of multimodal therapy. What are the relationships that the patient is inserted into? His relationships with his family, with his friends, with his colleagues, with his spouse or boyfriend or girlfriend, whatever. And finally, the D is for drugs or the physiological part. Um, and that's something interesting because a lot of psychotherapy models don't consider in their evaluation specific drugs or specific aspects of a person's physiology. Multimodal therapy contemplates that part into his evaluation. So, in doing the basic ID, a multimodal therapist uh, analyzes or evaluates the current situation. And the basic ID also is a kind of a roadmap to the intervention because the multimodal therapist will intervene in all those areas. What differs from other therapy models is that multimodal therapy says that you can integrate or utilize all techniques, even from other models, that justified and truly make sense in the evaluation part, but also in the intervention part. For example, if in my evaluation and intervention I decided that specific techniques from Gestalt therapy or emotion focused therapy, chair work, for example, are appropriate, then as a multimodal therapist, excuse me, I can utilize that specific techniques to intervene in a specific area for the patient. So, multimodal therapy is a therapy model open to the utilization of different techniques from different psychotherapy models. And that's why someone can consider multimodal therapy to be an integrative model, really a technical eclecticism integrative model. Multimodal therapy can be utilized with adults, with children and adolescents. Also, there are specific adaptations to brief interventions, but also into art therapy interventions. For example, the implementation of music and other artistic aspects. So, as a reading recommendation, a reading suggestion, I would suggest to you this book from Arnold Lazarus called The Practice of Multimodal Therapy, Systemic, Comprehensive, and Effective Psychotherapy. This book is one of the manuals for multimodal therapy. Another manual exists in a brief intervention way. I don't have that book in physical form, only in electronic form, but I will suggest to you this book if you want to know more about multimodal therapy. So, I thank you for your time and I wish you a good week, good weekend, and take care. I'll see you next time.